This is Alias, walking you through the steps of color vision examination. You have to understand that the color vision examination consists of two bits. One is to pick up on any congenital color blindness, for which you will always require an Ishihara chart, which are different slides showing numbers, and we ask the patient if he can see those numbers. And we do it with both eyes open when we're looking for the congenital. If you want to look for any acquired, we can either use the Nishihara chart with both eyes done separately, or it is a comparison between the two eyes, so we can also show them any color, red color target, and see whether it is perceived equally in both eyes. So I will start with the congenital color blindness test. We will keep this chart at this 14 inches or 35 to 40 centimeters away from the patient, and with both eyes open, ask the patient to read what number this is.
5.
And what is this?
74.
What is this?
12.
What is this?
96.
What is this?
73.
And if he is able to do all of these, that means he does not have any congenital blindness. Usually an Ishihara chart has anywhere varying from 11 to 16 slides, and if they can read 16 to 16, then they are not congenitally blind. Now, if I want to see whether there's any acquired optic nerve problem, which would cause decrease in color vision before it causes a decrease in visual acuity, we're going to repeat this test, and I'm going to ask him to cover his left eye and then read the slides.
5. 74. 12. 96. 73.
Excellent. Now we're going to do the same thing while he covers his right eye and repeat that.
5.
Now imagine that the patient cannot read numbers, or you want to do a quick test. So what you can do is you can just compare the red color between the two eyes, and the way that you can do it is take the cap of a tropicamide eye drops and switch on a light and put it on top, put the cap on top of the light, and then you will ask the patient to cover his left eye, and I'm going to show him, and do you see the red?
Yes.
And then I'm going to ask him to cover his right eye. Do you see the red?
Yes.
Is it equally bright in both eyes, or is it slightly fainter in one eye? If it is equally bright, then that means that there is no optic nerve problem, and color vision is compatible in the two eyes. Now imagine that you do not have the cap of the tropicamide drops. Then the other way that you can do it is you switch on the light and put your hand on top of this red hue, and you can just compare it in the two eyes. So cover your left eye, and do you see this red?
Yes.
And now cover your right eye, and do you see this red?
Yes.
If you can see that, that means the color vision is compatible in both eyes and there is no optic nerve problem. Thank you.